On the Scholars and Scrubs program, the Saturday program, we teach them health and wellness. We teach them hand washing.
You've been doing that. I have the whole list here, right?
Yeah. So like using the mannequins, and at the bedside, I had the little scholars reading to the patient in bed, so that they get the understanding that this child in a hospital may be afraid. So we use an emotional learning piece.
Right.
We have the students reading to them, so we're developing their reading skills, each one taking a turn, because literacy is really the true foundation of what we're trying to do here. But
so
then
we call that an integrated curriculum.
An integrated curriculum, exactly. But then the takeaway for them is also not only the reading piece, not only being kind and considerate, understanding their own feelings, but understanding others' feelings, but also a little bit of health and wellness. So if we are doing pulse, I've taught kindergarten kids how to do a pulse in this class, and we make pulse meters. They do a little craft, and then they go home and they tell their parents. So now we're bringing that health education out into the community.
So it's a combination of health and wellness, and then the more advanced sort of
so that middle
skills.
school will be actually doing a few more skills, a little more advanced. They learn a little bit more of the anatomy, what parts go at what. If it's a pulse, it's related to the heart and the anatomy of the heart. And then my high school students, they volunteer every Saturday, but I'm going to be using this as their clinical lab. So they will actually develop how to understand, respiration for the high school students, yes. And then the colleges will be coming in and hopefully aligning my program.
So what we have here is we can teach the students how they can look at a heart rate. This is an oxygen level, so we know if someone's oxygen level is good. There's some other things. This is our blood pressure, our pulse here. So what I can do is I can actually change the parameters on here so that we can talk to the students about different parameters. So if I do a different heart rate here, I can ask them what the heart rate means. See how my heart rate will change to a rhythm that we would have to actually do something about. We would have to respond for an emergency. I can change that back for them when we respond appropriately to that emergency. There's lots of things that I can also change. I can look at, I can look at some my respiration rate here. I can change that.
And then, I still have to work with these people on the floor. Right. Yeah.
Okay. The other thing that I can do for my mannequin as well is I can have her talk, or I can have her cough. Right now I'm going to ask her to cough.
There's that line.
And you can hear her. I don't know if you got to hear her, but you can hear her coughing. We'll try that again. I can also have her tell me she's in pain. I can also have her sound short of breath, and these are things that I can have the students respond to if I give them a scenario, and then I watch to see if they respond appropriately. And it's all about education and learning, and how to deal with this patient population.
Now, this program and this center will certainly give children an understanding of the medical field, and maybe give them a sense of if they want to do that.
Absolutely.
But it also pulls away the curtain of the mystery of medicine.
It does. It gives them a sense of, if they visit somebody in the hospital, it gives them a sense that it's not so scary, that there's certain things that they may see, but that it's normal and it's okay. It gives them a sense that they're nurses that they work with, and that's why we're in scrubs and lab coats, because we want them to understand that when they come to the hospital, we're not a scary place, and we can be very friendly and very, very welcoming to them, and we want to know them on that level. And that's why St. Luke's really enjoys partnering with this program, because this is our community, and we're embedded in this community, and we love the community, and we want to make sure that when the kids come in to see us, that they're comfortable. When the parents come in, that they're comfortable, and if they know our faces, it makes it even better. So that's our goal.
And we'd be surprised if 15, 20 years from now, some of these kids don't look to become doctors or nurses or lab technicians.
Correct. I hope we want to give them ideas of what they can do, where they can be. There's so many different parts of healthcare that they can go into. That's why I love healthcare. There's so many different things that you can do, even in nursing. So when we look at these kids, we just want to give them the opportunity to see what they can do, where they can be, because some kids, a lot of kids, from the time they're little, that's when they determine what they want to do in life. So we just want to give them a good opportunity and put some thoughts in their head for what they want to do moving forward. Hi guys! What do you think of our mannequin? We can in 1 second. What do you think? Come look at my lady. Come here. You want to come and hear something? I know it's noisy in this room, but if I do something... What's that? No, it's not a boy. See? What? See? Can you listen to something for me? Tell me what you hear. Listen to her. Tell me what you hear. What'd she just do? She's coughing. So what am I going to do if she's coughing? We could give her a tissue, right? That's right, because how do we want to cough? When we cough, how do we want to cough? To our elbow, right? Into our elbow, right? So we don't spread germs. Cough into our elbow. Good. Give them a tissue, and then what do we do after we cough and we use a tissue? What do we do with our hands? We wash them. That's right. We wash our hands. Because it's flu season. Absolutely, right? Everyone wants to stay healthy. That monitor over there, which one? The monitor? That's a heart monitor. So we can check, when someone is with us, we can check and make sure that that patient is doing really well. You want to try? Actually, can we look at this heart monitor? Because I've got this one working. Do you want to look at this one? Come here for a second. This is what this is. So this is her heart rate. I can change it. Let's give you a better heart rate. How do I know which one's this? So if I'm looking on here, what's that picture? That's a heart. So if I press on that, I can change what her heart is doing. Right? And that's how we learn, right? Let's give her a heart rate of 80.
What if her heart is going too fast?
If her heart is going too fast, like it just was, I just lowered it. If her heart is going too fast, we might come in and see talk to her. If her heart is going too fast, maybe when you run up the stairs, does your heart beat faster sometimes? Sometimes. When you hurt yourself, does your heart beat faster sometimes? So sometimes I'll look at this lady and I'll say,